Aloha. Welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator and ER physician. Today I'm joined by one of my favorite people, Dr. Linda Rosen. She serves as the CEO of Hawaii Health Systems Corporation. Previously, we had Linda on our show because she was the Director of Health and did a fantastic job in that capacity as well. Now she's moved on to this responsibility, which in many ways is actually more impactful on a day-to-day basis because she's responsible for our healthcare safety net. Hawaii Health Systems Corporation has several hospitals all across the state, and I'm going to let her explain more of the specifics of this program, but I wanted her here today because some of the most relevant legislation that was passed this year addressed the HHSC system, and here we have Dr. Linda Rosen.
Thank
Welcome,
you so much,
Linda.
Senator.
You
Thanks
bet.
for inviting me back.
It's my pleasure. So you, I should mention to people, you went to UCLA as an undergrad, then you went to Baylor, got your medical degree, then you went to Johns Hopkins and got your master's in public health, then you came to us and had a big role. Remind me and remind our audience what you did first before you were Director of Health so they can see how that fits into the context of what you're doing now.
Well, first of all, I spent my early career actually, doing direct patient care as a physician at Kapiolani Children's. I'm a pediatrician, and those were great years. But I came to the Department of Health about 2000, and I had a few roles there, but most recently I was in charge of the Emergency Medical Services branch, so ambulance services, trauma system, and injury prevention, and then, last year as director.
Yeah, and that is so important because as we begin our discussion about HHSC, I wanted people to understand that you were one of the key people first responsible for creating our trauma system, which we rely on, God willing, we don't need these services most of the time, but when I'm in the ER, you're doing surgeries historically, people need to know that creating that trauma system meant that Hawaii went from a place where we had no coordinated care necessarily to a way that we could get people the most advanced trauma services in their region and then over here onto into Honolulu and on Oahu. Yes. How did that work for you?
Well, first of all, we really owe a lot to the legislature who provided the funding through the Trauma Special Fund starting in 2009 to build the statewide trauma system. And one of the biggest focus for the development was the neighbor islands because, as you know, the injury death rates, and by the way, a trauma system, for those who might not know, is really a systematic approach to the problem of injury, right? Injury kills and disables more people under the age of 45 than any disease, right? Yeah. So we really wanted to see a system that could reduce those high death rates, particularly on the neighbor islands. And when we started, there was only one trauma center for the whole state, which was Queens. Yes. And Queens still is our highest level trauma center, but now we have level 3 trauma center on each of the major neighbor islands, and of course 3 on the Big Island. So that is already making an impact, and I think that the communities are very fortunate to have those specialized services.
It's a great thing, and I wanted to mention all of this because it tells two parts of a story. One is that I know people are very worried about cuts in services and with the challenges that we face in funding our healthcare safety net, HHSC. But I also wanted them to hear from you and see that you had to make a decision as a health policy person in the early days, along with me and a few others, that we would get the most important essential services intact. And you took our fledgling trauma system from a very basic space to an extraordinary comprehensive system, so that safety net was put into place. And that also gave you a very broad experience about what HHSC would need to be, and I think that interestingly may have been almost a trial run for you ultimately to be the CEO of HHSC years later. So just an observation.
Yeah, I would agree that my experience with the trauma system really taught me a lot about the challenges that the neighbor island hospitals, which are primarily all HHSC hospitals except for Wilcox on Kauai, the challenges that they faced in really trying to raise the level of care in their communities. And with the trauma system development, although we did have some funding, it wasn't a tremendous amount of fund, but I think it really showed the ability of systems to change things when people all work collaboratively to try to achieve a high standard of care.
Yeah, it's really great. I think of so many stories, but 2 years ago on New Year's Eve, I was on call. I tend to do the shifts on the neighbor islands on Big Island on New Year's Eve, and a child had a terrible accident with an explosive device. Some families and friends got together and they were doing aerial fireworks, and they dropped an aerial firework into a decommissioned tube from the military, and there was still a shell in there and it exploded. And so there was a terrific, terrible explosion. We were able, with just the terrific help of my nursing staff, we were able to keep the child alive, but then he entered immediately into the trauma system that you built that ultimately brought him quickly through North Hawaii, which is now helped and supported by Queens, and then over to Honolulu, where this child lived and today is doing wonderfully. You wouldn't know. He's got a scar, and it was very scary, but his young parents, I'm sure, appreciate the fact that their child didn't die. So
that's a great story.
That's exactly what happened. That happened about 8 minutes after midnight. It was obviously right after the turn of the new year and all the big fireworks were going, and that's what happens. And so these are real stories. It's not always car accidents or motorcycle accidents.
Right.
I encourage people to wear helmets, please. But you know, these things happen, but they have a real result because of the work you did. And now, we get you after your stint at Department of Health, where again, you did a wonderful job. We were named the best state in the nation as far as health indicators go while you were there.
Yeah, for public health and injury prevention, we did quite well.
Yeah, so that was great. But now on to HHSC. HHSC, why don't you unpack what that means first in our first segment here. What is the Hawaii Health Systems Corporation?
Well, the Hawaii Health Systems Corporation is a collection of hospitals, facilities that you could say are publicly operated, so government-operated facilities across the state. Folks on Oahu probably aren't too familiar with HHSC because the two hospitals on Oahu, Maluhia and Leahi, are, you know, long-term care hospitals that some folks really are not very familiar with.
Right.
But for the neighbor islands, really, they are, HHSC is the primary provider of health services. So on the Big Island, you know, we have the acute care hospitals of Hilo and at Kona, and a number of what we call critical access hospitals, like the one you work at in Kohala,
exactly,
and Ka'u and Hamakua. Likewise, on Maui, you know, we've got big hospital, but also Kula, a long-term care hospital, and then Lanai Community Hospital. And on Kauai, we have San Mahilona and Kauai Vets on the west side. So altogether, we have 14 facilities spread across the state.
And I think it's safe to say that people perceive HHSC correctly as one of the major pieces of our healthcare safety net. Of course, here on Oahu, like you mentioned, you can go to Queens, you can go to Straub, you can go to Kaiser. But on the neighbor islands, as it was evidenced last night when there was a vibrant discussion in Kona, that is the hospital for the region.
Right.
And so when people need to go to a big facility, not just their doctor's office, not an urgent care facility, but a full hospital, that's what they've got. So they always focus more, I think, as neighbor island residents on what will happen to our healthcare safety net. How you said there were you know, more than 10 hospitals. How many people work at these hospitals total?
It's about a little over 3,000 workers altogether. And, you know, that's a pretty big workforce, and some of our hospitals are the major employers in their communities.
Right.
So obviously our neighbor islands are very dependent on those hospitals. And you mentioned safety net. I don't know if that's a concept everybody understands, but, you know, I think its basic meaning is really those services that you might consider minimal in terms of safety net.
Yes.
And I think that concept goes back, you know, to a while ago in our state when the neighbor islands were really rural, not well populated. And so really there wasn't a lot of interest in building hospitals, you know, in the private sector. And that's where government stepped in and said, well, gee, we want these folks to have some basic services, and that's where the concept of safety net comes from, and government-operated hospitals.
Right.
But so much has changed in our state, you know, since that concept first started, and I think that's part of what I'm, you know, interested in, is to see how we can take these hospitals beyond safety net, because some of our communities have grown to the point where they really can provide more services in their own community that at this time people are coming to Honolulu for.
Right. I think for people like me who fly every week back and forth between the neighbor islands and Oahu, I sit there with a lot of my constituents, and they're coming over because they're getting a surgical consult of one kind, or they're seeing a gastroenterologist or some other specialty. We have a lot of wonderful physicians on the neighbor islands, and we have extraordinary services, but there are some services that people still require here on Oahu. And I think that I can speak for at least the people of Kona. we would always love to be able to stay at home and not have to jump on that plane, all due respect to Hawaiian Airlines, but we'd love to be able to get the full complement of care. I was on the plane with a guy yesterday who was coming over because he had a tumor on his kidney and he was going to be seeing a surgeon and an oncologist, and just a wonderful guy. He's going to do well, but it was too difficult at the time to find that service in the rural area. And so these are the challenges, obviously, that you're dealing with.
Yes. Well, you know, there has been progress, as you mentioned, you know, earlier in some areas, but we still have some important gaps in services. Right. And it's understood that you can't provide every service in the neighbor islands that you can on Oahu. But because of other challenges that we have, I think we're providing less than we could.
Yeah, I hear you. Yeah, I think one thing before we go to our first break that people need to realize is there are economy of scale questions. So, for instance, people have asked me, why don't we have a neurosurgeon on Big Island? We have a lot of car accidents, why don't we have a neurosurgeon? And I had to explain that with the total population of maybe 230 or 240,000 people spread out into at least 2, if not 3 significant population centers, it would first be completely impossible to have 3 neurosurgery teams on the Big Island. But also in most large municipalities, you have to have well more than a 250,000 person population to have a neurosurgical program. Right. And again, people said, why don't we want services right away? And we do, but you also want a team that does enough cases to be competent every day at the top level of providing that service and that care. And if you don't have that number of cases, you don't have, number one, enough resource to pay for a program, and 2, you just don't have the ability to track that whole team. So these are complicated.
I mean, when the population is too small, the neurosurgeon really wouldn't have enough to do.
Right.
And unfortunately, because of the distances on the Big Island, you know, it's very, very difficult to provide specialty services that cover the entire Big Island with one person.
For sure.
Very difficult.
So it's got to be teamwork, and it has to be some centers of excellence and moving people back and forth. But before we take our break, like I said, we are so happy to have the work that you did on the trauma service system, because we can seamlessly have a case that's a big accident, get someone to a center that can do the basic life support, do some extraordinary surgery if necessary that's life-sustaining, and then if they have to come to Honolulu, they'll get here more quickly than ever before.
Yeah, I think it's a good example of trying to organize the resources that you do have so that they serve people better. And I think we see that now working on the stroke system similarly. And I think regionalization, as you mentioned, centers of excellence is a way we can get the most out of the resources that we have.
Sounds great. Well, we're going to take our first break. Okay. I'm Josh Green, running this program, which is called Healthcare in Hawaii, and I'm joined today by CEO Dr. Linda Rosen. We'll be right back.
Hi, I'm Ethan Allen. I host Likeable Science on ThinkTech Hawaii, and I do this because I care about science literacy in Hawaii. I want to spread the understanding that science is a vital and interesting part of everyone's life. I want to make sure the broadest possible spectrum of people understand the beauty and the value of science and realize that science plays out each and every day of their lives. I want you to understand that science is fun. So we bring on to this show each week guests who are scientists, from astronomers to zoologists, and we talk about what they do and how they do it. But most importantly, we talk about why you should care about their work, why you should see that their work has value and impact on your life. So I hope you'll join us Fridays, 1 p.m. here on ThinkTech Hawaii. You can watch us via live stream. You can watch us recorded on Olelo, and you can see us each week. We hope you'll join us.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, ER physician from the Big Island, state senator here on Honolulu. Today I'm joined by Dr. Linda Rosen, one of my favorite people, who's our CEO of Hawaii Health Systems Corporation. You might have read a lot about Hawaii Health Systems Corporation in the news this year, because one of the major pieces of legislation at the Capitol revolved around this institution. This year at the Capitol, we decided that it was time to begin to give them other options to seek partners, to find some private equity and funding to fund some services. And so having the CEO today with me, she'll be able to tell us a little bit about where that stands and really why we had to pursue this. Again, good to see you, Linda.
Thanks, Senator.
So, okay, HHSC, 13 or 14 hospitals, 3,000 individuals that work there, like you said. Why is it difficult for us to be in the black as a hospital system? I know we've been hearing that across the country, that everyone's having this problem, but tell us a little bit about the Hawaii landscape.
Well, and as you mentioned, healthcare in general is what you might call low-margin business, right? It's a tough, difficult business. And we have challenges in terms of our ability to operate very efficiently. So, government operation of hospitals, it's not a traditional function, and it's really occurs when sort of nobody else wants to do it, and that's that safety net concept we were talking about earlier. But, now that we've reached a point, as I said, where our communities have grown, have become more affluent, there is interest in the private sector and operating hospitals on the neighbor islands. And this is an opportunity for us to raise the level of services at lower cost to the taxpayers. Our employees are really our greatest asset. But in our situation, we are operating hospitals with civil service rules and civil service work benefits, which are much more costly than what the private hospitals are paying. Now, that's not that we're paying our employees less. In fact, in the private hospitals, they generally make a little bit more in terms of salary. But for us, it's those retirement benefits, and we're paying into the, the retirement health system now. Those are some of the costs that end up eating into our revenues. So really, we do need that operating support from the legislature. It represents anywhere from 15 to 25% of the operating budgets of our various facilities. So they really do depend on that funding. But we do believe that for especially the acute care hospitals, and Maui is the first example, that if they were operated in the same model that your private hospitals operate in terms of the similar labor costs and access to capital and charitable foundations and all of that, that they really could provide a higher level of service at, without the taxpayer support eventually. And that's what we hope to see on Maui.
It's so fascinating to me. I think, so for people who haven't been very familiar with this, what you're saying is that like across the board, we have high costs of overhead, at a hospital like they have everywhere, but also we have been non-traditionally structured. And no one has more respect for our state workers than I do as a kind of a left-leaning political guy for decades. But it is not the natural fit that you would expect in many other areas like public works programs, road programs, and so on. So when you have to staff a hospital 24/7, shifts around the clock, whether they're 3 8-hour shifts or 2 12-hour shifts, every holiday, every weekend, because people are going to get sick on Saturday nights when I do call. They're going to potentially have a heart attack on Christmas Day. None of this changes the fact that we need to have people fully staffing our hospitals, and so the cost goes up. So there's that. And then my also understanding is that in some of the rural areas, like Big Island especially, the payer mix, the Medicare and Medicaid rates of reimbursement don't do us any favors. They're very low, as you and I know as doctors, and we have a lot of individuals that have some economic challenges, a lot of people on Medicaid on Big Island, but we would never turn them away at any of our HHSA system.
Well, of course not in our hospitals, as you said, they are safety net. They are bound by laws and by ethical obligations, to take care of their communities, and sometimes that's at an economic loss. That's for sure. And yet we feel that we could, as I said, operate more efficiently. And I will say that we're working very hard on maximizing our revenues and making sure that we're getting, reimbursed as we should be, because we have to help ourselves as much as we can with this budget shortfall. So we're working very hard. That said, we're in a business that depends on people getting sick and injured. And on the other hand, we're working on population health. My passion, public health, would be for them not to get injured and sick in the first place. But then how do you keep your hospital open? So this is really a struggle across the whole country, how to fund a necessary thing in your community like a hospital, but not have it drain money from your healthcare system by doing the expensive, sort of end of the road type of thing, and focusing all your resources there. Instead, try to move upstream and get people to be healthier. But you still need a good hospital. So we got to figure out how to fund it.
And we don't have the luxury also of simple consolidation in a region, because we have, you know, an island state.
Right.
So we have to have facilities on each of our islands. We have to have services ranging from basic to very advanced in each of our localities, or we have to be able to quickly get people transferred, and that's not always an option. I've been on call, on duty before, after an earthquake, for instance, when the road went down, and we couldn't get anyone out, and there were trees down on our helipad, and the guy cut his thumb off. And so I had to have someone from Tripler walk me through the reattachment of this guy's thumb, though I hadn't done it for years. And, you know, it's a small miracle that thumb still works today, but you get what I mean. We can't have the hospital closed, but we're never gonna get a hand surgeon there either, because there's only 2 cases a year. So we have a big task for you.
Well, that's true, and I think that it's important to understand that Oahu is getting pretty full and saturated. So a lot of patients that were transferred from the neighbor islands to Oahu, that may not be as easy to do in the future. We experienced earlier this year during the peak of the flu season that there were some delays, and so I think it's inevitable that the capacity on the neighbor islands needs to improve.
Yeah, and I would even also recall when HMC West closed for about a year.
Right.
We also noted, we docs on the neighbor islands, that it was much more difficult to transfer patients over because Queens was already full with patients coming from the west side. And so, you know, I gotta give credit to Art Ushijima and Queens and that whole team for, you know, stepping up and, you know, reinvigorating that hospital and spending a lot of money to make it a great point of service and just access for all of our people on that side of the island. But we couldn't transfer patients over here. So, but I digress, because what we saw at the legislature this year was, after analyzing the heck out of the problem, the legislature finally passed a bill to allow for a partnership for Maui. Right. Tell us about that. What does that mean? What could the impact be?
Well, of course, it's really a historic piece of legislation, because Maui will be that first public hospital to have a private operation. And although, as we've discussed, we think that that really is a key to stabilizing healthcare on Maui, it's a big change. It's a big change to ask those workers to change from being government workers to private workers.
Yes.
And it's a complicated transition. Sure. So we have a lot of work ahead of us in the next few months to make sure that, you know, the community is taken care of, that the employees are taken care of, and that we do it in the right way, because of course this is the first, and we want to make sure that we're very careful about it, you know, coming down correctly, so that people can see that it is a viable future for our hospitals.
Right. Yeah. For those who maybe didn't follow that as closely as others, now what will happen will be the folks at Maui will be able to enter into a negotiation with the governor as the lead, essentially, for the state, with other private entities that are embedded in Hawaii. So we're anticipating HPH or Hawaii, what is it?
Hawaii Pacific Health.
Hawaii Pacific Health, sorry. Hawaii Pacific Health, Kaiser, probably the main two. I don't think that Queens at this point has demonstrated a lot of energy, since they've got their hands so full with West and North Hawaii Community Hospital. But HPH and Kaiser will now have discussions with you and with the governor and their board?
Well, we're in the midst of working out the process, but as the law lays out, there'll be an announcement, which we expect will be coming out very soon, asking for letters of interest for any interested parties to submit their documented qualifications, because the law does provide for some prerequisites for that private entity. And we do think that HPH and Kaiser will be interested. We don't know if others will be interested, but it shouldn't be too long before those letters would be reviewed, and then those that are qualified who want to be applicants would then enter into a proposal.
Right.
And the hope is, as I think the governor announced last week at the bill signing, is they would like to accomplish the negotiation by the end of this calendar year.
Great.
So it's a pretty aggressive timeline, but of course with the funding shortfall that we currently have, you can understand why it's important to go ahead and try to proceed as quickly as we can.
Yes.
And yet, you know, look forward to that process working with the governor and working with the Maui region.
Yeah, it's so important, I think, that people understand that, number one, they're experts in the process, like yourself, who actually have seen the scope of the services, so you know what a good suitor would be, which was, I felt a great deal of relief knowing that you were the CEO at the time, because we have a new governor and we have always a change to some degree of who the board members are. We've got good CEO over there, and we know we've got good CEOs at HPH, Kaiser, Queens, but to have someone understand what HHSC has been and in an idealized form what it could be, that will really make a big difference in this negotiation. So I'm hoping the governor leans very heavily on you.
Well, thank you very much for that. But of course, I'm in my role because I really want to see healthcare services on the neighbor islands improve and stabilize. And so I will definitely do my best. And I feel fortunate that I have the background that I have. The many years that I worked as a pediatrician, again, being at a tertiary center, you get patients from all across the state. You're talking to doctors at every hospital in the state.
Sure.
And during the trauma system, we worked with Oahu hospitals, neighbor island hospitals together. So I feel pretty confident that I have a good sense of the major players in this industry here and of the needs of the neighbor islands, and hopefully that'll help me assist as best I can.
Sure. Some people have asked me, why now? Why did it happen now? And that's a very good question. I would say this, that because of the nature of healthcare costs and the impact of many things, Medicare reimbursements and Medicaid, and our challenges with payroll and so on here, we had a subsidy that was getting large enough that in a small state we couldn't accommodate what other states might be able to incrementally. So I think the line kind of got drawn in the sand, and you know, we're not going to continue to be able to have doubling of our outlay of tax dollars each year. So now it'll be fixed, is my understanding. We'll fix our support, so we're going to support the healthcare safety net, so to speak, and the services, but the partner will come in and they will add revenue, right? They'll add their own resources as necessary. Is that what you're anticipating?
I hope so. And you know, when you look at the healthcare industry, that's common. You invest to grow your revenues.
Right.
And so that's a significant limitation that we have in the way we operate now, is we really don't have access to capital.
Yeah.
And we're kind of living right on the edge in terms of operating capital all the time.
Yes.
And so we don't really have that option very readily about growing services. So that's a definite advantage that the private nonprofit hospitals have in the way they operate. And so I think that what we're going to find is that Maui is going to be successful. Yeah. But I think many people are waiting to see how this turns out in terms of how it comes down for employees and for the community. And you know, as far as why it didn't happen before, I think you know the issue has been raised. It has been a consistent and common concern for the legislature, the amount of funding that HHSC requires, and yet the solutions are difficult,
yes,
right? Because they mean very significant change for people, and change is always hard. But this was the year that it happened, so it is historic, and hopefully we can show that it was the right decision.
Yeah, and I think that we're going to get a very good taste of the kind of success that we can have. And if we don't have a good success, it would be unlikely we'd move that direction with the other hospitals. But if we do, if we provide even more stability for jobs, that was one of the points I wanted to make. We made sure that everyone would keep their jobs for a period of time, at least 6 months. And I'm sure it will be, most people will continue on indefinitely to the end of their careers, because we're so short on healthcare providers.
Right.
But I think that before we go to the break, people should be reassured that we'll keep those jobs in place because the services and the need continues to grow. But something had to give. And I didn't want to see cuts. I didn't want to see more people lose their jobs. I didn't want to see programs like the psychiatry program had to get pulled back in Maui, or some of the long-term care services in Kona got pulled back. We lost 30 jobs. I'd much rather see us investing and growing 30, 100, 200 jobs because we have a better model.
Yes, and I really do think that will occur. There may be some short-term changes because of the way they staff and their model of care, but most of the healthcare workers are going to absolutely be needed, and I think there are going to be more jobs and better jobs in the future once the change occurs.
Fantastic. To stop on that point, I'm going to go to break. This is Josh Green, Healthcare in Hawaii. I'm joined today by Dr. Linda Rosen, CEO of HHSC.
Aloha, I'm Keli'i Akina, president of the Grassroots Institute, and host on Ehana Kako, a weekly program on the ThinkTech Hawaii broadcast network. Ehana Kako means let's work together. Think of the sad alternative, let's not work together. Here in Hawaii, with all of our diversity and the richness of the people, it's important for us to come together around issues on the basis of what's right and what's good and what's going to serve the common good. And that's what we try to do at Ehana Kako. Every week we interview movers and shakers, people in government, business, and other sectors of society to talk about how to create together a better government, economy, a better world here in Hawaii that can bless the rest of the world. I thank you for your attention to ThinkTech Hawaii, and we look forward to seeing you every Monday, 2 to 3 p.m. on the ThinkTech Hawaii Broadcast Network. We're Ehana Kako, and we wish you well. Aloha.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, ER physician, and I'm also the Medical Director of the Hawaii IPA. Today I'm joined by Dr. Linda Rosen, who's one of my close friends over at the Capitol. We've worked together hand in hand on many projects. She was Director of Health and did extraordinary work there. She was also the head of essentially the transformation of our trauma system many years ago, which has meant that it's safer for people on the roads when they have accidents, whether they're visitors or longtime residents. So she's got the experience to lead HHSC, Hawaii Health Systems Corporation, into the future, and now we're putting a great deal of responsibility in her hands. So Linda, you told us in our last segment that we are beginning the transition of Maui Memorial to a private partnership, and you're going to be kind of there for that. What will this mean for all of our hospitals? Give us just, your crystal ball version of what could happen in the coming years for HHSC.
Well, of course, as we said earlier, this is a first, so I think there are a lot of eyes on how this turns out. And each of our regions is unique.
Yes.
As I mentioned earlier, they have different types of facilities, and so they are, in the midst of planning their own futures, and yet I know several of them are interested potentially in private partnerships, but there are unknowns. So I think that, looking to the future, one of the big questions, honestly, for the other regions is, how will Maui's exit from the system affect them?
Right.
And, the Maui region has assured the other regions that they do not want their departure to adversely affect the other regions. And yet, as we become a smaller system, there are, concerns in terms of the costs and economies of scale. And I think the other thing that, I realize is that our facilities are quite different. So when you look at an acute care hospital, which is like Hilo or Kona or Maui, that's a very complicated type of a business, lots of different service lines, very dynamic, a very different business than a long-term care hospital like Leahi, or even a critical access hospital like, let's say, Lanai or San Mahelona. So one of the challenges we have is really maintaining expertise in all of these different areas. So one of the things I'm interested in the future is I believe that the acute care hospitals especially probably need to be paired up in some way with the community operators of other acute care hospitals, like your HPHs, your Queens, your Kaisers, because they do have the economies of scale, they do have the expertise, and they can probably provide a higher level of acute care health services at a lower cost. Our other, safety net hospitals, I'm not really sure what the future is. And one of the intriguing things is if the reimbursement model changes, they may actually become more desirable. In the old model, or it's still really the current model, you make money by, doing more procedures, having sicker patients, having more what we call volume. And so these smaller hospitals, they don't do as well because they just don't have a volume of things that they do. But in the future, the hope is that healthcare will be more reimbursed around having people be healthy. How healthy is a group of people that you serve, not how many things did you do to them. In that regard, we might have some opportunities, even with our small hospitals, to create some really nice models in our communities for better health.
Yeah, we have the space there, and I've always wondered why we don't have, as we see, say, fewer admissions. It's easier to take care of people more quickly with some medications that we have now and some surgical procedures. Why don't we utilize some of that space for health education or for health surveys or for specialists to come in and do, in advance of what might have been a hospitalization, some fine-tuning of people's medications. So maybe we can draw some of those healthcare providers into the rural areas. Right. I even just heard that there's a prominent cardiologist that's worked more in the urban settings that is now willing to go out into Hawi and Kaba'au, into the real rural areas of the Big Island, because there's so many patients there now, older people having these needs, and he can see them there, something I never thought of before. Also, then there's the question of telemedicine. Why don't you mention that? Because I think that I've heard you wax philosophic before about how that could change the healthcare system. Could that work for us in the state of Hawaii?
Yes, I definitely think it could, and I think that's something that I'm very interested in promoting. And you have to wonder why we aren't really doing more of it. Part of the reason is that a number of years ago there was a lot of hardware, machinery, technical stuff you had to invest in. But nowadays everybody knows that it's pretty easy to transfer sophisticated information. As you know, for instance, we can transfer X-rays, CT scans, MRIs over the internet, and that's what's really enabled our stroke program, because now the neurologists can do a consult from their laptop. They're looking at the CT scan and they're looking at the patient in real time in video and talking to them, and they're doing the consultation. And so this is definitely a way that we can serve our remote communities better. So your cardiologist may be out there visiting, or your cardiologist may just set up their sort of contact out in the Big Island and then provide consultation really from their office or even their home. I think for subspecialists especially, it's a model that could really be economically viable, because if you think about it, you're working from your computer, you really wouldn't even have to have your office open. And it doesn't have to be in real time, which is more difficult, in real time we're all talking to each other at the same time. But for specialists, as you know, they have a lot of, specific information they want. The referring physician and the patient can get all that information teed up ahead of time. Right. And the cardiologist can review it, whatever X-rays, special tests, and everything. And then once they make that contact with the patient, they know a lot about them, and they can do a very good job. And in some ways, it could even be better than when they fly over to Honolulu and see them in the office, because their own provider can be, sort of engaged in that three-way conversation, or the nurse with the patient and the consultant, so that the information is shared better between the providers.
It's fascinating. I think, you're painting a picture of a very advanced healthcare system. But in some ways, we may be forced to go quickly to that because we have these barriers. And there are limitations on people taking a lot of time off work and traveling between the islands. And I want people to realize that these are such complex questions. People have asked me, why are we spending so much money, for instance, considering the health information exchange, to have health information be available digitally across all the different markets and all the different hospitals? Well, it's for this reason exactly, because someday you might not need to invest in $300 million of bricks and mortar for a new hospital, that there aren't enough people in a region to actually populate, but you could utilize these technologies and the expertise we have and the shortage. We can address the shortage of physicians. I think we can even bring some people back into the fold. I think some of the retired physicians that were, say, 70, 75 years old have an incredible wealth of experience and wisdom, and they would love to be a part of the healthcare system. But once you approach 80, it becomes taxing, and you can't expect someone to be on their feet doing surgery, but you might be able to rely on the benefit of their experience to be a consultant in this way.
Yeah, and the other way that the technology can help us isn't just with physician consultation, but imagine, again, going to your community. You're just discharged from Kona Community Hospital. You're pretty sick. You live, Miloli'i, Kau, somewhere down there, and the doctor wants to follow up, wants to make sure you're okay in a couple days. Now, are you going to take a 2-hour car ride up to that office in Kona, or would you like to have maybe the paramedic come to your home, take your vital signs and the EKG, put you onto the telemedicine link, and have your doctor do the follow-up with you in your own home?
It's really something.
And you would not have to travel.
And I can only imagine that you could expect the cost of that consultation to be far less than the cost of a consultation, not just because you had to travel and fly and whatnot, but you can see a lot more patients potentially that
Yeah.
way if the program got set up.
I like to also mention that that follow-up patient who just got out of the hospital, if they get their follow-up visit at home, at least they won't be at risk for catching the flu in the doctor's office.
Yes, for sure. And we don't need a flu epidemic, and we don't need people standing in long lines and waiting at the hospital.
Well, the traditional go to the doctor's office and sit and wait to be seen is something I think a lot of patients would prefer to have perhaps another method. So again, that's where the health information exchange. So it won't just be, you know, physicians and specialists talking to other physicians, but physicians interacting with their patients more.
For sure. And I think also we'll be able to utilize some of our other interdisciplinary relationships, like with our nurse practitioners and our practitioners, physician
Definitely,
assistants.
not just physicians.
Yeah. Oh yeah, I know.
If I said physicians, I didn't mean to.
No, you've been a big advocate for the the full kind of medical home model, and
it takes a team.
It does, and we have pharmacists coming out of our pharmacy school.
Right.
We have all these individuals. We're about to wrap up. The hour has gone extraordinarily quickly with someone who knows this much like yourself. Just give me a last few comments, if you could, Linda. The future of healthcare in the state of Hawaii. We seem to be right in the throes of major change and challenges. Are you optimistic?
Well, yes, I am, because I always hold on to the fact that we are one of the healthiest places on earth. And we have a great population. We have the spirit of aloha. We help each other. We support each other. So I think that, striving to be the healthiest community we can be is something that everybody can support. That said, there's a lot of resources and money that goes into healthcare that could perhaps be spent better in other parts of the community. So that inspires me to work on that prevention side to see that if we can really get healthier folks and at lower cost.
Yes, well, I'm excited to watch it unfold. This has been Josh Green, Healthcare in Hawaii. I've been joined by our CEO of HHSC, Dr. Linda Rosen. She is the right person at the right time in this position. She will help shepherd us to a time when we have some partners with our public hospital system, and she's also focused on the larger picture of healthcare reform. Thanks for joining me. We'll have Linda back for sure with an update on how that process is going in Maui and how it will impact the rest of our state. Thanks again.